Schools resumed a few days ago in the midst of a pandemic. Terrifying stuff. But there are assurances from many quarters that the school environment is safe for learning. Students and non-students in the academic environment just have to adhere to non-pharmaceutical guidelines for COVID-19 and things will be just fine. If you're anything like me, you'll be overthinking this situation and freaking out. I mean, civil servants grade level 12 and below are still not allowed to go back to work. And trust me, schools are more crowded and rowdier than those offices. But maybe we are overthinking this. Are we? We have questions in our feature story. Our guest on the program is an environment expert who has quite a lot to tell us about the correlation between the environment and COVID-19. You don't want to miss that. Plus, on our Abuja wrap, President Muhammadu Buhari joins Nigeria's first tax dialogue. The Vice President launches a register for the urban poor, and the country gets an additional 38 oxygen plants to fight COVID-19. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I am Kayla Magwa. Students have gone back to school and we're watching ever so cautiously in the nation's capital, seeing as we are one of the country's epicenters for COVID-19. We are in a second wave and adherence to non-pharmaceutical guidelines is still quite low. We'll get to that in a bit, but first, let's take a look at the activities from Nigeria's seat of power. President Muhammadu Buhari hosted President Patrice Talon of the Republic of Benin and reiterated the importance of good neighborliness. In a statement signed by his media aide, President Buhari says the two countries must continue to engage to forward a common understanding on crucial issues, including security, trade, and development. Meanwhile, President Muhammadu Buhari is committing to promoting good governance practices in Africa. Speaking at the signing of a memorandum of understanding between the Committee of Heads of State and Government participating in the African Peer Review Mechanism and the Federal Republic of Nigeria relating to the Technical Assessment Mission, the President lauds the progress made so far in the Africa Peer Review as a self-monitoring tool to address governance deficits on the continent.
We may recall that Nigeria was first peer reviewed in 2008 and has recorded some accomplishments in the implementation of the National Program of Action. Our administration has continued to vigorously pursue security, economic diversification, and anti-corruption as the main thrust of national change agenda. The totality of this strategy is premised on the promotion of democracy, respect for the rule of law and human rights, gender equality, and by far the largest investment in social change in Nigeria's post-independence history. Nigeria is keen to be joining the League of African Union member states, which will undergo the second peer review exercise. This is a firm demonstration of our belief in the dividends of democracy through this unique peer review system.
President Muhammadu Buhari has also launched the National Oil and Gas Excellence Center, which is situated at the Lagos Annex of the Department of Petroleum Resources. The president, who did the launch virtually from the State House in Abuja, says the initiative aims at strengthening Nigeria's position as a regional leader in the oil and gas industry. The president also opened the MAIDEN National Tax Dialogue virtually. He says his administration does not have any intention of increasing taxes. However, he insists that the loopholes enabling foreign and local businesses to evade taxation must be blocked.
This administration is, however, not seeking to increase the tax burden upon the citizens, but to plug the existing tax loopholes or leakages and to ensure even an equitable application of the tax laws.
The president has sworn in new members of the Code of Conduct Bureau and the Police Service Commission. He performed the brief ceremony for the 3 new members of the CCB and 1 for the PSC. The federal government has announced plans to empower 1 million urban poor Nigerians who have been adversely impacted by the effects of COVID-19 within the next 6 months. Speaking at the official launch of the Rapid Response Register, the Vice President, Professor OSINBAJO, observes that the program, which targets poor people in urban areas, is in furtherance of the government's pledge to provide social security for the vulnerable.
While the COVID-19 containment action was effective in slowing down the spread of infections, it also impacted the urban informal workers and dwellers, especially those daily wage earners that could not work due to loss of jobs, due to business closures, or restrictions on movement. As for this category of people who were not previously captured in the social register, the Ministry of Humanitarian Affairs, working with the NASSP, designed an intervention to rapidly identify, register, and provide them with succor.
Vice President Professor OSINBAJO says plans are underway to expand the facilities of the National Reference Laboratory Center of the Nigeria Center for Disease Control. He made this known during a tour of the laboratory to assess the facilities on ground.
We agree that we have a critical situation on our hands currently, with the increasing number of cases being recorded. However, we have made a lot of progress since Nigeria's first case was recorded in February of 2020. We have activated nearly 120 laboratories nationwide, 70 of them public laboratories, and have significantly ramped up our testing capacity and case management. We have expanded the footprint of our sovereign public health response capabilities, especially at the subnational level, and in areas where previously such capabilities simply did not exist. Not so long ago, test samples had to be flown out of the country for examination. This is no longer the case, as we now have capacity to process samples internally.
In the meantime, President Muhammadu Buhari has approved 6.45 billion naira for the setting up of gas plants in 38 locations nationwide to enhance the treatment of COVID-19 patients who need oxygen. Briefing State House correspondents after the first National Economic Council meeting for 2021, Governor Ifeanyi Okowa of Delta State explains that the gas plants became necessary following the surge in COVID-19 cases due to the second wave of the virus. Another first meeting of the year that held this week is the Federal Executive Council, with President Muhammadu Buhari presiding. The council approved the Harmonized Retirement Age for Teachers Bill, which gives legal backing to plans to enhance the teaching profession in the country. The bill moves the retirement age for teachers to 65 years from 60, while their years of service move from 35 to 40.
Council approved that a bill, which will be called Harmonized Retirement Age for Teachers in Nigeria Bill 2020, to be sent to the National Assembly for enactment into law. So that all the promises the President made, all the approvals that he had given me, would now begin to be put into effect, because this is the legal backing that is required for it.
Staying with the education sector, schools resumed academic activities for the first time in 2021. However, the Presidential Task Force on COVID-19 is warning against any complacency in the enforcement of the safety protocols.
The Presidential Task Force will continue to dialogue with the governors and the Federal Ministry of Education to closely monitor the situation and, if need be, review that decision. Nigeria has moved up to third position in highest cumulative case load, but remains second for new cases. We must do everything possible to avoid a second lockdown in Nigeria.
Welcome back. The resumption of schools in Nigeria has been met with mixed feelings across the country, and understandably so. Here in Abuja, we contribute 14,000 cases to the nation's COVID-19 disease burden of over 160,000 infections. Our feature story examines this worrisome truth and plans to keep children safe in the nation's capital as they go back to school. Students in the nation's capital are back in school after they were given an extended Christmas break following the reports of the second wave of the COVID-19 pandemic.
You can see them coming in with their face masks. They wash hands before going in. And they were observing the social distance, no assembly, all the protocol listed by COVID-19, this school is observing it. Office of the Minister of State came to do the fumigation last 2 weeks, and the school did his own yesterday.
Teachers, if you are going and see any child, if you enter the class, any child without wearing children are children, anywhere they behave their. So first of all, any child you see without face mask, you will be what? Will be called out of the class. Then at the same time, those that would have their own inside the pocket, they're children, so they can put their own inside the pocket. They will do what's corrected to wear their own. Then some hang their own by the mouth without covering the nose. You direct them what to do. Then those who didn't come to the school with their own, we made some available at the gate.
Upon resumption, the students are subjected to health checks in line with the COVID-19 protocols. They also participate in cleaning the school premises. The schools have been rearranged to accommodate the guidelines for school resumption in the classroom, while the teachers have the mandate to enforce compliance to the protocols. The students are resuming amid reports of rising cases of the coronavirus, and the Federal Capital Territory is one of the epicenters in Nigeria, with very high statistics of infections and fatalities. According to the Nigeria Center for Disease Control, the FCT contributes over 14,000 cases to Nigeria's confirmed cases of COVID-19. At least 118 parents have also died from COVID-19 complications in the FCT. On Friday, January 8th, the number of new infections in the FCT hit 153. It rose to 206 on Saturday, January the 16th. Notwithstanding these scary realities, many residents still do not adhere to the safety protocols while engaging in their daily activities.
We have done a lot of sensitization, risk communication, because, as you are aware, this is one of the biggest challenges in the fight against COVID in this country. There are a lot of myths and misconceptions about the virus, even its existence. So we have to be talking a lot in the marketplaces, in the communities, radio, television, social media, all over this. We fill the space of the media to ensure that people are really informed about the COVID-19 and its means and ways of preventing it, means and ways of getting it, what to do and what not to do in order to break the transmission. By and large, I think in summary, that's what we've done in terms of the response.
There were at least 10 isolation and treatment centers in the nation's capital during the first wave of the virus, but 2 of these centers have been shut.
The isolation center now is actually what I would call interesting. Interesting in the sense that you now find a situation whereby the presentation of the patients are not the usual typical presentation that we used to see during the first wave. We have more additions. Although we know we have now gotten used to all saying that, okay, loss of taste, loss of smell and the rest, now we now have more complications coming into the treatment centers. Now we now have patients that require dialysis, and then we also have patients that actually have other comorbidities that are not, kind of those comorbidities that we usually kind of like expect. Now you now see sometimes you see patients actually coughing and coughing. The cough sometimes bring out some little tint of blood, and we see that now in patients, and it's not really quite interesting because the more you look, the more new symptoms come in, and then you see more patients coming in. Bed capacity is basically is full, and we can tell you that actually bed space in terms of capacity and the rest is it. And I think we need to thank the FCT administrators and then the Honorable Secretary of Health, who is actually trying to expand new treatment centers, so that the load in the University of Abuja Teaching Hospital Isolation Center will be reduced. And then manpower can now be drawn from other areas to actually try to see how you can assist other centers that have been opened. One thing that is classically clear is that more patients require oxygen.
Nigeria's COVID-19 cases are rising rapidly in the midst of so much uncertainty about the ability of an already overstretched healthcare system to manage the situation should the cases continue to rise uninterrupted. My guest on the program is the Registrar of the Environmental Health Officers Registration Council of Nigeria, Dr. Yakubu Mohammed. He speaks to us about disease prevention using the environment. According to him, we have an unhealthy focus on curing diseases, forgetting that the recovered patient still has to go back to the environment and most times will get reinfected. He believes this is one of the reasons COVID-19 still thrives, not just in Nigeria, but around the world. Watch this. Dr. Yakubu, welcome to Dateline.
You are welcome, my sister.
All right, so just to be clear, Acting Registrar, Environmental Health Officers Registration Council of Nigeria. You've been in acting capacity now for about 6 months.
That's correct.
But this is an office that, the history of your office is very interesting. You've been doing, this has been in existence in Nigeria since 1902.
That's correct.
Talk to us a bit about what your job, what your job actually is and the history of this organization.
Thank you very much. Environmental health was recognized as a profession in Nigeria through Act 11 of 2002. But the history of the profession begins with the colonial masters. Why? Because the colonial masters emphasize on preventive health. And what they succeeded in doing is to be able to train personnel within the country so that they can reduce the burden of diseases, because they want to economize the funding and spending on the health sector.
I grew up, seeing sanitary inspectors come to the house every Saturday.
Yeah.
They would inspect first of all, there would be environmental sanitation exercise. I grew up in Kaduna, so that was what it was called.
Yeah.
And you would have to make sure that the gutters are clean, the streets had to be clean, and it was done by residents.
Yeah.
And then they would come and inspect it. And then there was even a time they'd go house to house, to check. Why did that stop?
The challenge we have is the preventive health, which is supposed to be the global. If you look at the global practice, all the developed countries used to strengthen the preventive health, because it's when the preventive health has failed, then the curative health can be able to manage and return them back to the environment.
So that brings me back to the health officers. Why did we stop the environmental sanitations on Saturdays? And why did the health officers stop going house to house? What happened?
Well, let me give you an analogy. The environmental health services are local government responsibilities. And as we speak today, the local government system is not recruiting the environmental health officers. Let me give you the analysis. You go to some local government, you realize that the environmental health officers that are in the service of the local government are less than 10. And looking at the dynamic and the complex of the environment we are managing today, these 10 environmental health officers are insignificant.
Absolutely.
And also the local government system doesn't make necessary budgetary provision. If you recall, the sanitary inspector is among the 6 persons that participate in Nigerian amalgamation because of his strategic importance. And even when most of the other professions are not in existence, the environmental health officers or the sanitary inspectors is the one health personnel who is responsible for vaccination. If you recall, when our forefathers are using the jet injector, they are trained on that capacity, and also the preventive health at that period is very strong, where you see the complement, because the environmental health profession has a complement. We have what we call mosquito scouts. As at then, we have the inspector of nuisances who are responsible for day-to-day house-to-house inspection. And also, they are responsible also for food hygiene and safety by making sure that the food is safe from farm to table. And all these things are not there because the local government is not recruiting the environmental health officers. And the issue is this: where the health sector as a whole is handled by one professional. And that's the problem we have in Nigeria. Because if you look at the health industry, The health minister is a medical doctor. The permanent secretary may be a medical doctor. The director of public health is a medical doctor. Director of hospital services is a medical doctor. And you can't give what you don't have. And all of them are putting government policy toward curative services. And nobody is looking at the preventive services. Let me tell you, more than 80% or 90% of the diseases that is ravaging our community today are environmental sanitation related diseases.
It actually came to my mind at the time when we started doing community testing for COVID-19. And then we had to start setting up teams. You know, it felt like a fresh job. You know, they were trying to get new people to go into communities. And I started thinking to myself, at the local level, if we had environmental health workers, as we used to do back then in the 80s and the 90s when I grew up, wouldn't that be easier for us to be able to do the kind of enlightenment campaigns that need to be done in those areas? Just get the environmental health workers to do when it comes time for vaccination. Are we going to have to do a fresh recruitment? These are things that environmental health workers can do. Is there a plan, sir, to revive that culture?
As we speak today, the minister has mobilized close to about 40,000 environmental health personnel under the environmental health emergency response. And these 40,000, they have been trained. With this COVID-19, they were trained virtually and they were certified by the ministry. And let me tell you also, the minister mobilized these 40,000 when schools are opening for WAEC. And that's why you see, because of the surveillance desks that we have established in the school, in a modest town, we recorded less casualty throughout the success of the exam.
Now that schools have resumed, how much surveillance has been done by your office, and is it safe? Should parents rest easy that the schools are safe for their kids to continue their education right now?
For the Unity colleges that is owned by the federal government, the ministry, through the collaborative effort between the environment and the Ministry of Education, we are able to decontaminate and disinfect the Unity colleges. And also the minister has issued the certificate of fitness, giving a clean bill of health to these schools that we have intervened. And he equally mentioned, because part of his policies is to engage also the private sector, because most of the schools are owned by private individuals. And he also equally directed that all the private schools should engage a licensed environmental health officer to be able to decontaminate and disinfect these schools. And what also the minister has promised is additional collaboration with the Ministry of Education. While the tertiary institutions are about to open up, the ministry will utilize this workforce, the environmental health emergency workforce, that are within its ambit to be able to mount the surveillance and also make sure that the enforcement of the guideline as issued by the PTF is adhered strictly.
Dr. Yakubu, thank you so much for coming on Dateline.
Thank you very much for having me.
Quite a conversation. Let's keep it going on our social media handles showing on your screen. Let us know how it has been since the kids went back to school. Are you confident of their safety? Are schools doing enough? We would really like to know. Thank you so much for watching. I'm Kayla Megwa. See you next time.